Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we're following up with part 2 of our most important stretches for spondylolisthesis of the lower back. Hope you enjoy. So in part 2 of our spondylolisthesis stretches, the most important stretches to do, we're going to target two muscles, the erector spinae of the lower back and the latissimus, both of which, when they're tight, they increase the arch in the lower back and aggravate spondylolisthesis, aggravate that bone that slipped forward by compressing the facet joints, the spinal joints in the lower back, the posterior or back portion of the disc fibers, and several other soft tissues. The erector spinae muscles we're going to be targeting come from the pelvis and the lower aspect of the spine, the sacrum, and they travel up into the vertebra and the ribs on both sides of our spine. They're located about 1 inch to 3 to 4 inches out on both sides of the spine. These muscles can be stretched safely in the seated position for those with spondylolisthesis by placing your hands on your thigh just above your knee, and as you lean forward and slightly to the side, far enough to feel a stretch on the opposite side of the back, anywhere from your ribs to your pelvis, you're going to maintain that stretch for 15 to 60 seconds. Now you notice I'm using my entire upper body weight so it's supported on my hands. If I were to do this standing, my muscles can't relax. They're holding me from falling forward. That's going to be against what I'm trying to do, which is to relax and stretch those muscles. So it's important I let my whole upper body weight relax into my arms and hands. And of course, I'm holding any RPI corrections for my unique problem with my posture and my mechanics. If you're not cognizant of what your posture and mechanical issues are, go to the Pain Free and Fit or Posture Size websites, take our free body analysis. This is imperative. If you're not holding your corrections, if you have a tendency to hike one hip or rotate a pelvis, and you're not holding that in position as you're doing your stretches, you're only promoting more soft tissue dysfunction. You're only strengthening your ability and reminding neurologically your body to use that when you stretch and when you move. And that's only going to put more stress on your spondylolisthesis in the long run. So maintain your corrections as you're doing these stretches. You're going to do that to both sides. The side that you're going to finish with, the sequence of these stretches is important. If you have a tendency to hip hike on one side, or if you have a tendency to side lean your torso or externally rotate your leg, again, you'll find that on the analysis, figuring out what your unique mechanical issues are, then you want to stretch away from that side last. You want to stretch into that side first and finish stretching away. And the reason is because that's the side where your erector spinae muscles are going to be tighter, and you want to finish off stretching those tighter sides in a corrective direction. The second stretch we're going to do in the part 2 stretches of spondyle is for the latissimus muscles. They run from our shoulder down into our lower back and pelvis. Many times they're tight in people, and as a result they increase the curve and aggravate spondylolisthesis in our lower back. So the way we stretch latissimus muscles is by holding the tailbone under. We're going to reach up and slightly over until you feel a stretch anywhere from the shoulder down towards the lower back. You can do that standing without holding on to anything, holding on to a post like this therapeutic rack. You can also drop the hip on that side while maintaining a tail under tension. If you don't maintain the tail under tension, you many times will arch the back. You're not going to get as much benefit from the stretch. So maintain, besides all your RPI corrections, a tail under correction while doing this. You can also do this in the seated position by using an opposite arm post, little tail under, and lean sideways. Again, like any of our stretches, we're going to hold that for 15 to 60 seconds until the feeling of stretch disappears. Once it does, we go a little further with our reach, maintaining tail under tension or RPI corrections for a second stretch. You can do 2 or 3 stretches 2 to 4 times a day. These stretches, along with your hip flexor stretches shown in part 1 of this video series, will help to decrease the tightness in the common muscles associated with spondylolisthesis. If you've enjoyed this video and would like to help me help others, share this vital information with those suffering from spondylolisthesis, give me a thumbs up below. If you enjoyed this video series, would like to learn more, subscribe to our channel. We got a lot of great videos on spondylolisthesis healing exercises. If you want to learn more about spondylolisthesis and develop a home exercise program to heal your unique condition, we've got a great program that's available on our website at painfreeandfit.com known as the Fast Track Healing Exercise Program for Spondylolisthesis. It just came out this year. A lot of subscribers have already purchased it and are enjoying it. That's a great way to learn not only the stretches, but all the corrective exercises, goes through all your analysis, relaxation exercises, pain relief exercises, we talk about nutrition, whole bunch of great things to help heal your spondylolisthesis. Give these stretches a try, plug them into your routine. Hopefully they'll help you with your spondylolisthesis lower back pain.